All right, doc, so today we're gonna do MRT of the cervical spine, okay? So, patient's gonna be supine. Make sure you have some emollient. Grab a hold. I think the biggest thing that usually comes of a problem with this is the patient, you know, I'm sure we've all had this before, but the patient tenses up and they don't want to relax their head. So it's very important you grab a hold, talk to your patient, let them know that everything's okay, and they, hey, relax a little bit, just a little bit of relaxing, if you have that problem, right? But with the neck, the main things that we're going to focus on with the neck are the suboccipital muscles. We're going to work on the SCM muscle here. We're gonna work on the scalenes over here, and I am gonna hit a little bit of that levator scap as well. So those are the 3 or 4 main things that we are going to attack today for the cervical spine. So let's get started here, let's get to work. So the very first thing, having the patient here, I just cup the ear and kind of just make sure that the ear is perfectly cupped with my fingertips angling down toward the sternum here. And you can take your hand away after that or your thumb away. Bring the patient's head back to neutral, right? Because here what I'm getting ready to do is a little bit of suboccipital stuff, some scalene stuff. I'm hitting a lot of things in here. That's why I mentioned all those muscles. Remember, these things are all attached all over the place, so to isolate one or the other, it's definitely a little difficult, but the idea is we're making sure the motion is there, right? And that's understanding what these things do from an activation standpoint, to an origin standpoint, to an insertion standpoint. In this case, so like say SCMs and scalenes. SCMs are bilateral flexors and contralateral rotators, and of course the scalenes themselves are just lateral benders. So here we go. Bring the head back to neutral. Laterally bend and rotate towards your hand as you come back the other way. And you're gonna do this, leave the head down and kind of rotate it. Pull all the way up by the occiput. Start again. Shorten everything. The wheelie chair works great for this because it allows you to be able to have a nice, easy flow with the patient. You can leave the head down even though you're kind of blocking it here. So that's the first one. And everything I'm doing, you're gonna do bilateral, don't forget. The next thing, let's get after the scalenes a little. So here, I'm gonna find the mastoid process. I'm gonna fall right down off that mastoid process, so really right below the earlobe, if you will. I always do this with my thumb. Don't dig in, just place your thumb here. Bring the head back to neutral. This time, you're gonna laterally bend, but you're not going to rotate. Hold it into this lateral bend. As you bring the head back, just laterally bend to the other side. Just let your thumb strip all the way down. It just goes. So start it off again. Thumb, laterally bend. As I laterally bend to the other side, just let your thumb strip all the way down the scalene. Absolutely amazing. The last one, and the one that feels the best for the patient, go right where you feel the trap. Make sure that you're right here in contact with all of those paraspinal muscles running all the way up in those extensors in the cervical spine. Place your whole hand. You can use your entire hand, not gonna matter. Not really any major point of contact. Place the head back down. As you bring the head up into the opposite direction. So I'm on his left side, I'm gonna bring his head over to the right. As I bring it up to the right, I'm gonna strip all the way up into those suboccipitals. Bring it back down, all the way up into the suboccipitals. And that is how you're gonna do MRT for the cervical spine. Let's get to work, docs. Peace out.